You joined, Doctor. All right. Hello, everyone. Good morning. This is Mithun Vakaria. First of all, I want to thank everyone for taking time and registering for this webinar. We are really excited. Hi, Dr. Samir. How are you doing? It's been good to connect with you over here. Hi, Dr. Amal. How are you doing? Hi, Ravi. So, without wasting time, since we have already crossed few minutes from our scheduled time, we will get started. So, once again, thank you everyone for taking time to join this webinar. And as you all know, the topic of this webinar today is Beyond Archival, building a unified patient longitudinal record, irrespective of what system your organization is using. What we want to do here today is just to explain the concept that even if you have any number of systems in your organization, you could still build a unified longitudinal patient record using both your legacy information as well as your current active system that you're using in your hospitals. So my name is Mithun Wakara. I'll be the presenter for the keeping items. If you have any questions, feel free to put them in the chat and we will definitely revisit and answer each and every of your questions. In case if you're not able to provide the answer during this meeting, we will definitely send the meeting notes as well as the answers to your questions if it's being unanswered within this session. Having said that, please be everybody on mute, and we will have a dedicated Q&A session as well, where you can ask your questions verbally. So this is going to be our session format where I will be presenting this slide deck as well as we are going to do a demonstration of our solution that will take about 30 to 40 minutes. And then we'll have the remaining time for our interaction or Q&A that we want to have. And the agenda for today is going to be very short and sweet, very focused to GCC region. The healthcare data challenges, what are they, and what we think are need of the hour, why traditional archival approaches fail, and what are different types of traditional archival that some of the organizations deploy even in this uh, age. What is the unified patient longitudinal record? So we are going to define what is unified patient longitudinal patient record and how do we achieve the unified longitudinal patient record using the Data Hive platform. Some of the key Data Hive use cases that would help you to relate on how the data has to be consolidated and create a unified patient longitudinal and all the different benefits that it provides to the organization. And then followed by a live Data Hive demonstration, and then, of course, real world transformation scenarios. So without wasting further time, I just want to deep dive into this session. Again, if you have any question while I'm presenting this slide, please feel free to put them in the chat. So what is the scenario today? What do healthcare organizations across GCC uh, want within their systems? How do they want return of investments for applications that they are deploying? How do they modernize their systems and processes? As well as what are the compliances or different initiatives that they have to look for that they are compatible and they are able to share that information with different programs out there in each country. So the major drivers, according to us, are these following: national digital health transformation programs. So as you are aware, most of the GCC countries has made it mandatory for most of the healthcare organizations to share the data. So in Abu Dhabi, we have Malafi. In Qatar, we have QHub. In Saudi Arabia, we have NAFIS. And all these mandates sharing of information with the health information exchange. The problem here is most of these require both legacy data and active data in a specific format. So, for example, Malafi predominantly requires data to be shared in HL7V2 format. QHub requires in Fire. Nafiz is a hybrid, which is a combination of Fire and data exports. So each country, each health information exchange has their own requirements, and it becomes sometimes even more difficult for organizations that operates in different GCC region, irrespective of whether they are using one application or multiple application to comply to this. So that is one of the major drivers for modernizing of your healthcare data ecosystem. The other one is modernization initiatives. As you're aware, in healthcare, most of the transaction information systems or record systems are still very old in terms of how they are being operated. Either they are on-prem or built on a very niche technologies. So we see a lot of organizations want to modernize through the transformation programs, either by transitioning over to the new HIS, which is AI compatible, which is compatible with all these modern standards like HL7 and Fire, and also to reduce the hardware cost by migrating them into the cloud. So we are seeing a lot of health information exchange or HIS, ERP, EMR, CRM modernization initiatives, which also is one of the drivers for healthcare data ecosystems to be looked into. The other drivers are hospital acquisitions and network expansions. Now, this is more applicable for larger entities, which is in a spree. For example, Mubadala Group in Abu Dhabi is in a spree of acquiring more and more primary and tertiary care hospitals, and that comes with its own challenge. That is another area that is driving need for a platform like Data Hive. The fourth and other points, as you can see, is AI being the talk of the town. Everybody wants to be on that boat of AI and wants to leverage their system processes and data for AI programs in the future. But the fundamental problem with AI is you need to have the data foundation ready. And that is possible only if you're able to unify all these data or information or systems together and tie them together without losing the clinical context. Analytic readiness is also another major driver. As we can see, a lot of hospitals have embarked in the data warehouse programs, and sometimes they report out of only one system, or maybe the systems are being reported separately and then reports are then tied together manually. This also creates a lot of bottlenecks. And then we have regulatory and compliance mandates, which I already talked about, not just from the HI standpoint, but also from the security and governance standpoint. And then at the end, we have the interoperability expectation, which means that irrespective of the data sharing that is required, not just with the third party application, but also with external entities, the platforms or the needs has to be robust enough to handle all different formats, whether it is HL7v2 or Fire or data export, or if it is compliant with OMOB in case if you're sharing the data with clinical research and pharmaceutical companies. So all these are the major drivers, but then of course, as I pointed out, some of these initiatives do not do well or takes long time, primarily because the data is fragmented in multiple systems, or data is not consolidated in a data warehouse that is OMOP compliant or is robust enough to handle not just EMR HIS data, but also ERP and CRM data. We also see a lot of data, especially the legacy data, is locked in PDF, which itself loses its value because then you are not able to search very specific content that is required for your reporting and analytics purposes. Inaccessible historical records, again, we have seen scenarios where hospitals lock their historical record in another backup server without getting access to the clinicians as and when required, and obviously poor interoperability and high maintenance costs. So these are all the different areas that the organization today is looking for a solution that can rapidly help them modernize these ecosystem. Having said that, this is a typical landscape today that is available in most of the hospitals or healthcare organizations. They have multiple systems like HIS, EHR, ERP. Some are retired systems as well, which are still in operational just because they wanted to access the legacy data. There are departmental applications that are very specific to their workflows and their need. So, and again, some hospitals do have VNAs, but then it has a limited capability in what type of data it can hold and what options are available to view that data in real time. And then it creates more complexity when the hospital or the organization starts acquiring other systems or other hospitals and then have to integrate that data along with their enterprise system. So all this is what is happening today in most of the healthcare organization. So I would say maybe take a minute and just reflect if your organization also is undergoing such a landscape where it is too hard to maintain and manage so many different siloed applications, and then still wanted to unify the patient health record and all the other information related to that patient to build that clinical context. It is a hard job and it takes sometimes years and years, and still we feel that the data is not complete. But that is where we are trying to solve this problem through this particular solutions that we are going to propose today. So the legacy system problem, everybody knows these are the common challenges, which is data silos, incomplete patient history, increased cybersecurity risk because you have to manage so many different applications hosted either on on-prem or on cloud without enough cybersecurity components built in because some of these applications are built 10, 20 years back. Expensive legacy infrastructure, which means that you have so many hardwares to support and manage, slow and non-interoperable clinical workflows. Even today, we see people extracting the data manually through reporting platforms and then trying to convert that through a middleware engine, which basically then shares the data through FHIR and HL7, which is a long time consuming process. And then poor patient continuity, difficult compliance audits. So all this basically adds up to the problem that the healthcare organization today suffers in terms of extracting the value from your own healthcare data ecosystem. And the most common and key question that we are asked here in health in Santaware is how do we retire the legacy system without losing access to critical clinical information? And that's exactly what we are trying to help answer today. And we might be right in our approach or might have to fine tune some of the things that we are talking about based on the discussions and your inputs. But the goal is to help you to retire those legacy systems, build unified patient longitudinal data, not just from your legacy application, but also using your active systems that are in use today. So let's deep dive. So, what are the traditional archival and why do they fail? Now, these are the four most common ways on how the hospital sometimes archives their data from their legacy systems. One is the PDF only archival, which basically means you import everything into a PDF document and then store that PDF document in a document management system. Now, here the problem, as everybody can imagine, it's not a structured data. You lose the clinical context. Clinicians don't have the visibility. They cannot search very specific things. There is no context, and it is very hard. And at the end of the day, it just becomes another document sitting there in your system and without you giving you the output that you require. Now, so much of information is lost because of this process. The second one is the database backup, which again is technical in nature, but it doesn't serve the purpose because you just back up the data of your legacy application and put it somewhere in your server. And nobody other than your clinical team has access to it. And there's no real clinical workflow integration. And your clinicians do not have the visibility of that data. Plus, also, it's very expensive in terms of restoring the data again if you want to use that and then build it and integrate it with your current application. And the third problem we see sometimes when what they adopt is they keep the legacy system alive, which means even though your users are not using this clinical systems, the legacy systems, but they still keep it alive just so that they can access the legacy data for compliances and audit purposes, which in turn brings a lot of high cost to your organization in terms of maintenance because you have to have certain number of licenses active. There is a vendor dependency, security exposure because you're not using the system but the data is still having to reside in those applications, and sometimes the maintenance on those applications is negligible, which sometimes exposes you to security vulnerability. And of course the infrastructure burden, which you could always try to shorten that in terms of cost as well as in terms of maintenance. So that is also not a good way of managing your legacy data. And then the fourth problem is lack of interoperability. Now, if you archive your data in any of these three methods, obviously you cannot share that data. You cannot readily transform that data into HL7 or FHIR. And also you cannot do any analytics. You cannot have data available for your AI programs or initiatives that you plan to undertake in the future. So long story short, sometimes organizations end up spending a lot of maintenance on these systems or on these approaches and on these ways of archival, which is not very conducive, and it doesn't actually give you any return of investment, whether it is direct, indirect, or from strategic standpoint. So this is the problem that we are trying to solve, which is what is the best way of archiving this data efficiently and then unifying the data across all the systems into a unified patient longitudinal data. So let's define what do we mean by unified longitudinal patient record. Now, imagine a scenario where your organization has a legacy system and an active system. Now, somebody has to bring the data not just from all these applications, but has to tie everything together. Now, one system might have a different medical record number versus the other system. And there are chances that patient records might be duplicated. So, somebody has to run an exhaustive EMPI or Enterprise Patient Master Index just so that we have a unique patient identifiers across all the systems, and then efficiently we can all this tie together to create that holistic view for your physicians, clinicians, and other users. So that's what it means. It basically completes the clinical context of your patient, irrespective of whether the patient has visited you 10 years ago or they are just as old as 6 months. But the idea is to have everything tied together under one clinical patient record, what we call as a golden record. You can also include your ERP data elements. You can also include your customer relationship management data elements. You can also include your human resource. So ultimately, you're basically aggregating all the data under one single data warehouse platform. Now, what are the benefits in order to do that? Faster clinical decision making because the users or the clinicians has access to the legacy data and active data, and they have the complete clinical context, and they can see the timeline of when the patient's encounters were made and what different diagnosis was made during those encounters. It gives you a patient continuity, and it also reduces clinical frustration because they don't have to reach out to IT department every single time they need to access patient's data, which is 2 years, 3 years old. It also helps administratively by simplifying the audits in case if you are applying for JCI or any other quality initiative programs. It's very easy for you to have access to that data and share that with the auditors for them to ensure that you are compliant in terms of your reporting, in terms of your practices and processes. Improved interoperability again goes without saying, since you have all the data under one roof, it's very easy for you to just share the required data in a specific format that is required by these different agencies. And of course, AI ready historical data set. So then you can run your AI initiative programs down the line in the future. So the outcome that we are trying to uh, highlight is you have one patient, which is your golden record, one timeline, you know, across the patient's journey, when he had visited, for what reason, and what all the tests that was performed on that patient and the medication that was prescribed. And it doesn't matter whether the patient resides in your legacy system or in your active system, it's all tied together as one unified longitudinal patient record. And that's where data hive comes into picture. Now, this is not a product, but it is an infrastructure or a platform. It is not another software, but more of a data ecosystem that we are trying to help organizations with to modernize their data platforms. So what does it do? It does multiple things. It actually aggregates the data on your behalf, whether it is from the legacy applications like HIS, EMR, ERP. It works as a unified vendor neutral archival. You can have discrete data, you can have unstructured data, you can also have data from your ancillary applications like your PACS, your lab systems, your financial applications, all tied and residing in one central data platform. You have a unified patient timeline viewer. Now, since we are aggregating and normalizing this data and bringing into this platform, you don't have to spend time or years of effort to unify this. Our proprietary engine immediately cleanses this data and builds the timeline that is readily accessible for the clinicians to view the entire patient's journey. It is OMOP compliant as well as Ministry of Public Health compliant as well as CD, fire compliant. So Whether you are sharing this data or you have to audit this data against a specific standard, or you have to use this data for secondary research or for your clinical research, it's all easily done through this platform because the output of this could be generated in any format that you wish to share this data with. As well as it has role-based access control, so it is secured. um, Only authorized people who are working in your organization has access to your data, and nobody else would be able to see the patient's information, which is very critical. And it is cloud. It could be cloud hosted or it could be on-prem, depending on the policies of your organization. It also provides a robust audit and compliance support. That way, you have track of your data in terms of data lineage, in terms of who's accessing data at what point in time, what are the different workflows, why the data has been accessed for, whether it is to share with external agencies or whether it is to just do a secondary research by your users in the organization. Now, this platform could be used by anybody. It could be used by a single hospital, by a secondary or a tertiary level hospital, by multiple hospital groups, by government healthcare networks, by specialty clinics, healthcare payers, and digital transform, and anybody who has undergone digital transformation initiatives. So it is pretty holistic platform, and it has multiple sub solutions and accelerators or tools that is built in depending on the need for each of the organization. So, what are the different use cases where this comes handy? And every organization will have its own journey when it comes to modernization of their platforms. And we have tried to list out all the different use cases where we think this platform or this service could be relevant. So, having said that, the number one use case is somebody wanted to decommission their old system and move to a new application, which is either cloud hosted or it is AI ready. But at the end of the day, you have been using legacy application for, let's say, 5 years, 10 years, 15 years, and there's a lot of value to that data, and you don't want to lose that data. So that's where Data Hive comes into picture, where we provide an extensive 8-week program working closely with you and your legacy application team to not just extract historical data from these systems, but also normalize and index these records as per the compliant that you wish to have it for. That way, you can create a patient centric access, preserve legal medical records for your audits and compliances, and also you can retire expensive legacy systems, which will in turn help you save hardware cost, license cost, maintenance, or the teams that you have right now deployed in order to manage them. So we promise this to be done if it is a clinical information and financial information within 8 weeks. If the scope of these legacy applications also extends to other systems like ERP, then this timeline could be extended to 12 weeks to 15 weeks. But it is something that is very tangible. You can actually see the actual process and the workflows. And here we ensure that there is zero data loss. You can actually validate each of your data against your legacy system through the archival viewer that we provide. So it is an end-to-end, very robust process that is put in place to archive and decommission your legacy system. As I said, the outcomes: reduced infrastructure cost, faster data access, you have the viewer, you can see the patient timeline, everything is available under one roof. Um, Clinicians don't have to depend on IT teams to get access to the legacy data. Lower security risk because you have already decommissioned your legacy system. And right now, you just have to manage one system that kind of houses all that data for you. So that's a very common and most typical use case of data modernization or application modernization. The second use case is your AI and analytics readiness, which is in case if you have already migrated to a new platform, you have already archived your legacy data, but now you want to ensure that your data, the foundation, is clean and accessible so that you can initiate long-term AI and analytics programs for your organization. Now, what are some of the barriers in order to do that? Sometimes we see, as we had discussed in our earlier slide, people archive the data in a PDF format or just have it as a database backup, or as simple as just have the live application. So those are all the common barriers: unstructured documents, siloed systems, missing patient contact, inconsistent format. So what we provide is a data assessment service, which basically means that we get into your system, see what the scope of the applications are, whether those applications are structured enough for you to say that it is AI ready or fire compliant, or is accessible easily in a discrete format. We assess that against the standards, either FHR standards or OMOP standards, and then give you a recommendation. Now, those recommendations are easy as tweaking small workflow changes to your existing application, or it could be as easy as just integrating some of your legacy data along with your active systems. What this means is it creates a structured historical data set, which is OMOP compliant, which is NAFIS compliant, which is QHub compliant, which is Malafi compliant, irrespective of which country that your hospital operates from. It is FHIR ready. That means you can easily share the data in a FHIR format. There are 128 FHIR profiles. You could literally share the data against any of those 128 FHIR profiles, depending on the requirement that you have to share. And the most important aspect of this is the patient history is searchable, because we normalize this data and bring it in a structured format that you could search from your progress notes, from your discharge summaries, all the clinical context that is relevant for the patient, whether it is the uh, diagnosis, physical history, social history, family history, medications, allergies, vital signs, etc. All this helps you to train your AI more efficiently, because now this data is in structured format and you can easily tokenize this and put it into a vector database for you to build very exhaustive generative AI capabilities against your data. The other use case is the regulatory challenges. Now, compliances audits is part and parcel of our healthcare ecosystem, because this is one of the most regulated industry, as we all know. And time and again, you have to share this data with your auditors, you have to share this data with the ministries, you have to share this data for various grants that you're trying to apply for, or you have to share this data for clinical research or any research programs that your hospital has undertaken. Now, all that is possible if you have the clean data. And again, you have to augment or aggregate all that data from different systems. It's the same use case where we kind of archive from multiple applications, clean it, structure it, make it fire compliant, make it NAFIS compliant, or make it easily shareable with external agencies for whatever the use case is. So you have the complete audit log, you have the role-based permissions, you have encryptions, and you can easily comply to the quality standards and ensure that your hospital continues getting those certifications to ensure that you provide the highest patient care possible. Now, all this has an indirect benefits in terms of governance, in terms of compliance risk, in terms of audits, and it gives you a continuous improvement of your data quality. Now, I want to talk a little bit more on Data Hive as to what do you expect. As I said, it's not a product, it's not a solution, it's more of a platform or an infrastructure that is a combination of sub solutions, accelerators, and tools that could be leveraged or deployed depending on the use cases. So, this is a very high level architectural overview as to what is expected. So, there is an ingestion layer, is what we call as the data ingestion platform. It has the access layer where you can interact with your legacy data and active data with a viewer capability. It has the API management, which is robust enough to handle each and every type of data, whether it is EMR data, it is coming from ERP. It has a service layer which helps you to filter, sort, augment, control, and search different types of data through different slice and dice mechanisms. It has a storage layer, it has an integration layer, it has a security layer, and of course, it has the uh, reliable platform that kind of augments all this under one roof. Now, what all applications it supports? It, as I said, it supports literally all the systems that are used today in a healthcare ecosystem, be it HIS, EMR, PACS, ERP, RCM, radiology system, lab information system, scan documents or a document management system, or any data that is residing today in the hospital ecosystem. All of that could be your source system. And the ultimate goal is to provide you clean, accessible, searchable data, which is not just compliant, but also easily shareable. And you can make use of that insights by building your own proprietary reporting or analytical layer on top of it, either using Power BI, Tableau, and you can go one step further ahead by actually implementing natural language processing, which means the users or your end users can interact with your own data with simple query like show me all the patients who is suffering from diabetes for last 2 years under so and so doctor, for example. So that means you just provide the prompt and then the application or this data have layer actually provides you the answer in a generative AI format. So that's the value or the use case that we are trying to highlight through this architecture. Now, again, we are trying to highlight what are some of the common challenges and how data hive delivers those outcomes or solves those problems for you. So if you have a problem of fragmented data, that means your data is residing in multiple systems and you don't know how to bring all that together. Data hive actually unifies and archives that data, and we actually also provide NLP search capabilities on your structured data, which basically means you allow us to extract and normalize that data on your behalf and then have that data residency within your ecosystem, and then you can interact with that data. The other challenges is inability to access and search legacy clinical data repository or archival. It again goes back to my earlier slide where I mentioned that some hospitals or organizations, even though they archive the data, but they don't archive in the format that is most efficient. Either they do it in a PDF or in a database backup, or they just keep the legacy system alive and just log in and see that. Again, that's not very efficient. So Data Hive solves that problem for you by bringing that data and of course reducing your overheads in terms of infrastructure, license cost, and maintenance cost for those legacy applications. The other problem is lack of trust in extract and migrate data, because most of the typical extraction migration follows medallion architecture where you bring the data as is in a raw layer and then you normalize. But when you normalize the data, there is no actual viewer for the end users to validate. So what we provide in the data hive is a viewer capability which unifies all of this data under a patient's timeline, and you can easily do one apple to apple matching with your legacy data or with your any other source systems that you're using. So you have the viewing capability as well as you have the timeline capability. The other problem is risk of sharing or lack of sharing. Now, this is primarily because some of these data do not comply with your FHIR standards or HL7 standards, whereas Data Hive provides that layer where you can easily convert your data and it augments that data or enriches that data so that tomorrow you can easily convert them into HL7 and FHIR within this proprietary tool without needing another third-party application to do that and share that with your external agencies. So it solves your interoperability challenges. The other problem is poor data quality and coding inconsistencies. This is very common because standards keep changing and evolving in healthcare, and you also have to implement them based on the payer's recommendation if you are heavy on submitting your claims and getting reimbursed for your hospital, and that is what your primary source of business is. Data quality and coding inconsistencies, even though there are tools available to catch these inconsistencies, but I think our principle is to solve them at the source before it even lingers out in the RCMs or other downstream application. So that way you have the strong foundation and your data quality is top notch when they are being submitted for claims. And how do we help that is by standardizing your coding terminologies, by standardizing your data management through our metadata management solutions. And we provide proper clinical context by extracting that data from your unstructured data and tying it with the CPT codes or the ICD codes that you're using in your organization. And of course, without saying, building data warehouse and reports is the ultimate goal for most of the healthcare organizations so that you have the insights on the performance of not just your departments, but holistically across the organization. So Data Hive provides analytics ready quality measures in terms of data marts, facts and dimension tables that you can slice and dice based on your need and generate not just the operations reports, but also trend reports, predictive reports, as well as quality reports. And the other challenges we see is inconsistent patient records or EMPA issues. Again, as I said, when you are tying data from multiple systems, the most fundamental task or the preliminary task is to have a clean EMPA record. And that is time consuming and it has a lot of complexities involved since you're working with so many different applications. We kind of help you with cleaning that up and having that patient longitudinal record. Now, having said that, I will just take about 5 minutes since we have already done 30 minutes of presentation. Quick look on what data have looks like and how we unify that patient data on your behalf. So this is the platform. It's a cloud-based platform. You can host this at on-prem as well, or you can host this in any of your ecosystem, whether it is Google, whether it is AWS. It comes with role-based management where everybody has their own username password. It could be easily integrated with your enterprise SSO applications so that they don't have to have different username password. It could easily be tied to your enterprise ecosystem. Once you log in into application, now what I'm going to show you is the viewer part of it, where we have already extracted the data from multiple systems. We have normalized or enriched that data. And this is how that data would eventually display in this format for you, where you can see each individual patients and their relevant data. So right now we are just going to show you the clinical records, but we also have the capability to bring ERP data, CRM data, revenue cycle data, as well as any specific ancillary application data like blood bank or radiology. So once you log in into, this is the dashboard where you see the most recently accessed patients. So I'm going to use Limewood as the example for today's demonstration. So once you search, you can search by first name, last name, by age. It is pretty powerful in terms of search for your patient record. Once you identify your record, you can just click on it and then it gives you a clear view on the entire journey of this patient. So here you have different tabs. By default, it only shows you the most recent visit. So this patient had 4 visits, as you can see, 1, 2, 3, 4, and it shows only you the recent visit. So what I'm going to demonstrate or show you here is how do you interpret this data. Now, on the overview section, you see the most important components. Product is not coming up. Okay, 1 second. Share. Okay, I think there was some issue. I'm going to just while it loads up, I'm just going to go back and see if there's any question on the chat. Hello. Yeah, so there's a question from Ravi Kothari. Okay, I have a question. We are planning to replace our legacy EHR. How can we decommission the old application without losing access to historical? So this was already covered in our presentation, but just to answer to your question, I'll keep it short and simple because we have very less time to do the demonstration. Is yes, it's very much possible. What we typically do is we kind of do the assessment of your legacy applications and understand what are the data elements that you require that you cannot lose and what is your ultimate objective with this. Once we do that, the typical process is we extract that data and then normalize in our platform. And then we give you the viewing capability, that one that I'm going to show you right now. And you can validate that apple to apple with your legacy system. Once you're satisfied, and once you have brought all that, and we provide a lot of reports and validation tools to ensure to make you ensure that there is zero data loss, and that way you can bring all of your data into this viewer and then retire your legacy application. I hope that answers your question. So this is the platform. As I said, it's a cloud hosted platform. Once you log in, you get into a dashboard, which basically shows you all your patients that you have accessed recently. We're going to take Limewood as an example. As soon as you click on the patient's record, you get a detailed view of this patient's journey. And the most recent visit is by default selected. So as you can see, this patient had 4 visits in 2024, starting in January. Then in March, he had 2 visits. And then, of course, in uh, September. Yeah. So the most important part of any patient record is allergies, medication, because this is what the doctors always look for. So it's always available in the overview section right at the beginning, and it also shows you the severity as well as the active medications or discontinued medications. It also shows you the diagnosis and recent orders that was placed for this patient. Now, it might show you only the first 5 records, but then if you click on view all, you can see all of it. But the idea is all this data, for example, for this Limewood patient, has come from multiple sources. It has come from legacy system as well as it has come from the active system. What we did here is we brought all that data, cleaned the EMPI, and tied all this data together. So when you tie this data, here we have an option called patient timeline. This is how the entire data is tied together, and you can actually have the entire journey of the patient view here. So it is in the ascending order. You can see encounter number 1 displayed at the top. Then you have encounter number 2, 3, 4, all tied together. Now, each encounter would have captured some information, and it is all available for you here. You can see in encounter 1, the patient had an allergy when it presented to the doctor for an outpatient visit. He had a penicillin allergy. Doctor diagnosed him with COPD, exacerbation, as well as pneumonia. And you can also see all the medications that are ordered by this doctor against those diagnoses, which is amoxicillin, which is oral in nature, for the patients to take twice a day, erythromycin, and albuterol inhaler, which is your suppository. And then you can also see the lab results. So this patient had not just lab results, but also radiology results, chest x-rays, CRPs, creatinine, and you can see the values against each of these blood tests. And at the end, you can also see what the doctor had written in terms of the progress note for each of these encounters. And you can see the progress note here. And if you want to see the details of the progress note, it's very easy. You just have to click on the documents under the patient's record and select the visit. And you can see the progress note here. So you can see the patient was advised hydration, have reduced smoking sensation, strict return precaution of worsening shortness of breath, and the findings was that patient had acquired pneumonia, and patient is clinically stable, but was prescribed to continue with the antibiotics and inhalers, and encourage a lot of oral hydration in terms of have water, juice, and reduce smoking cessation, and visit the clinic after 5 to 7 days. So this was what happened for this patient. Now, just to explain to you in terms of the journey of the patient on how to interpret this data is you go to the encounters, you can see this patient had 4 encounters. The very first time the patient visited was an outpatient because he came for an annual health checkup and with a complaint of fatigue and weight loss, and met Dr. Julian at infectious disease department. Now, as soon as it was diagnosed that patient might have an acquired pneumonia and the progress note was written with some recommendations and antibiotics and inhalers, the patient visited again as an emergency patient. Now, why? Because he had a worsening shortness of breath. He did not follow up on his advice from the doctors to revisit again after 2 weeks. So this time around, since his shortness of breath was worsening and he had confusion and general weakness and persistent fever, he was admitted to the emergency department immediately. And if you want to know what was actually the diagnosis in that emergency encounter, all you have to do is just click on the diagnosis tab and click on your emergency encounter. And you can see that patient had acute kidney injury that was diagnosed, severe sepsis, and a septic shock. Now, all this was determined because there were certain lab tests that was run on the patient, and you can also see the results of those lab tests right here for that encounter. You can see the chest X-ray was done, which basically shows multipolar pneumonia with bilateral lower lobe. It also showed elevated uh, biomarkers on uh, pH levels, blood cultures, lactate, and creatinine, which basically help doctors to diagnose this patient's uh, diagnosis as acute kidneys or severe sepsis. And then the medications were prescribed against it. You can also see that he was immediately admitted to the hospital on the same day. So you can see there was another encounter created, which is an inpatient encounter. Now, this encounter basically tracked the patient's progress towards the plan that was prescribed, which is in terms of having oral rehydration, having uh, antibiotics, and oral uh, vapors to suppress the infection, and have cannula and ICU. So all that is recorded. Now, the point here is, now this is the data from 2024. Now you can see the entire patient's history was typed in this platform without losing any information, and making the pertinent information visible in this viewer for the physicians to quickly make that determination. So today we are in 2026. Now imagine if this patient has visited and the doctor opens their current EMR, they might either have all of that legacy data in EMR, which is a very rarity, or they could easily integrate this viewer as part of their EMR and then see the entire history of this patient, where he was an outpatient, visited in 2024. Then after 3 months, he was admitted in emergency, which required him to have an inpatient stay of at least 3 days in ICU and in the ward. And then there was a pulmonology follow-up, which kind of improved his situation with terms of sepsis and pneumonia. So all this is easily available. Now, this is the viewer, which basically helps you to view or visualize that information. Now, I want to show you one important feature where the end users can also interact with this data. So now they might not want to see the entire patient timeline or the data in this more structured format, but they might want to interact. So we have a feature which is an NLP based, or what we call as a generative AI. Now, let's say a user could easily put a simple question in a natural language. Some of the questions are already predefined here, so I'm going to use one of them. So let's say I want to know the number of patients by gender that are available in this database. Now, since this is a demo database, so we have a very limited number, but in real situation, you might have millions of records. It will actually look into each of those patients' records and then group them by gender. So this is a very simple NLP question that the users could interact with. So what it does is some of the operational as well as some of your day-to-day reports requirements that you have reduces, because then you don't have to rely on your IT team. You can just interact with your data right here in this NLP. So here is the result. You can see it's in the form of chart. It tells you that you have 8 female patients and 18 male patients. And if you want to see it in the tabular format, you can just click on the table and you can see this and extract this or export this data for your reporting purposes. Now, let's say I wanted to ask another question to this and say, can you show me a patient with sepsis as the diagnosis? Now, this is a very generic question where I want to know all the patients who have been diagnosed as sepsis. So typically it should list all the patients, but what I'm looking for is Limewood, because that's the example that we're going to use today. And it should show me the patient name or MRN. And there it is. You can see there are two patients, Jane Doe and Limewood. This is their MRN, and this is the diagnosis description. So both this patient had sepsis. Now, since this is a demo data, you just have two records, but in real world, you can actually create registries using this NLP, which is quite powerful because you don't then have to look into different criteria. You can just type in your criteria and it will do all the legwork for you to get you that registry, which you can easily export and provide it to your specific departments or interventions or providers to um, reach out to for follow-ups. So this is my patient. So I'm going to use Limewood today. So now I can use this MRN and I can say, can you show me uh, medications, medication that was prescribed to MRN so and so. So what this question typically should yield is the name of the medications that was prescribed for this patient across his encounters. So all in all, he had about 10 to 12 medications that was prescribed across 4 encounters. So now as a doctor, I can quickly see what are the medications that was prescribed for this patient. Now, after it analyzes the query, it's going to give me the result, and there it is. It shows there was an erythromycin, there was amoxicillin, there was albuterol inhaler. Since the patient had a sepsis, he was prescribed an inhaler during his initial visit. Then there were some antibiotics like vancomycin. There was an IV that was provided during his emergency visit. Now you can slice and dice this the way you want if you want to add more further conditions. But this is the generative AI capability that is built in where you can interact with your own data. So the need for IT interventions or reaching out to the IT for every small ask for reports drastically reduces for your providers. Now imagine this is just the legacy data that we have brought here. Now if you bring both the legacy and active data, the capability of um, having insights using this NLP feature or generative AI feature is humongous for your end users, both your clinicians as well as your administrative staff. Now, that is a quick demonstration of the product. I will take a pause here and see if there's any questions. One last thing I want to recommend if you're all interested to deep dive further and maybe do one-on-one sessions, we offer free legacy application assessments. That means you let us come in and allow us to see what all legacy applications you have. We prepare a detailed report and provide you recommendation steps. We also do data inventory analysis to see what all data you have available across your systems, what could be retained, what could be let go, whether the data is interoperable, whether the data could be shared, how the data resides, whether it's in PDF format, whether it's in structured format. So we do those kind of analysis and we do it for free of cost. And uh, we provide the suggestions and recommendations. We can also help you with archival strategy in case if that is something in your mind, if you are in the middle of modernization programs or decommission programs. Uh, Other than those free services, we can also do proof of concepts if you want to see if a small subset of data could be leveraged and see if that is helpful for your organizations. We do that at a very controlled manner by providing that proof of concept. And we can also help you with migration and decommission roadmap so that you can present it to your sponsors and get the budgets approved. So we provide all these consultation services. Some of them are free of charge and some are very negligible in terms of pricing. But these are all the different engagement models that you could come to us and we can help you with this. So having said that, I'm ready to take more questions and have this interactive sessions. All right, so we have another question. So we are almost 50 minutes and we have about 10 more minutes to go. And I'll take some of the questions from you. So another question is from Amar regarding longitudinal record. Our patient data is spread across multiple systems acquired over many years. How do you create a single longitudinal patient record when patient identifiers are inconsistent? Uh, that's the key. And if you remember in one of the slides we discussed, enterprise master patient index or golden record is the key in order to have that inconsistency solved for this organization. So what we do is we extract the data from all the legacy applications and using our proprietary EMPI matching logic, we try to identify a single patient across these systems, irrespective whether they have different MRNs, different identifiers. But that logic provides an exhaustive criteria for you to match and have that golden record. Once that is determined, then it becomes easy because then you can just merge all that patient record across the systems. And we can show you some of those examples once we have one-on-one detailed sessions with you. And if you're interested to know more, we can do a small POC and show you how we have done this for other organizations. The next question we have is from Samir. In terms of ROI, what outcomes should organization realistically expect from healthcare data archive? Well, that's a good question because return of investment is in everybody's mind, not just in the minds of CEOs and CIOs and CTOs, but in like what I'm going to get if I invest time and effort and money into this program. Well, I would answer this question in a way that everybody realizes the benefit or has the return of investment. It's not just in terms of the monetary benefit, but I would basically classify this into three areas: the direct benefit, the strategic benefit, and the indirect benefit. So obviously the direct benefit is you can retire legacy systems. That way you can reduce your cost, licensing cost, hardware cost. The indirect benefit is all your data is under your control. You have the control of your information on how you share that with other agencies, other vendors, other partners, as well as less cybersecurity risk. These are all indirect benefits. And then obviously the strategic benefit is you are compliant depending on the evolving situation of the country that you operate in, whether it is Malafi compliant, whether it is OMOP compliant, whether it is NAFIS compliant. You can also make sure that you have the data that is ready so that you can plan your future digital transformation programs like AI programs, analytic programs, and also you can continue with your quality assessments so that you can share this data with auditors freely at on demand without investing time and effort, and it's readily available. So that way, at least whether it is a JCI accreditation, whether it is ISO accreditation, you always ensure that your not just your processes but your data and your systems are always helping you to maintain that standard of care that you provide to your patients. I hope that answers your question. If there's any more question, please feel free to put them in the chat, or we can have them take here in the session as well. Thank you, Dr. Amal. Thank you for that compliment. Um, I will be sharing this deck with you after this meeting, and it would be lovely if we can have a one-on-one call after this meeting or whenever your time permits, maybe this week or early next week, so we can deep dive further into some of the questions that you had asked, as well as some of the questions that you might have after this session. But thank you for that great word. All right. So I think there are no more questions. We have about 2 minutes left, so we all get 2 minutes back. Once again, thank you for taking time to join this webinar. Again, to just let you know, every month we are going to have webinars on different topics. So I encourage and feel free to please join, and we'll share as much as information from our experience and the work that we have done, not just in GCC, but also in US. But again, I want to thank you all for taking your time and spending 1 hour with us and patiently asking questions and listening to our thoughts. Thank you so much and look forward to talking to you, everyone. Thank you so much. Bye.